This is going to be Lab Data Interpretation Introduction Part 1. Many patients will have varying diagnostic tests performed before they actually get sent inter-facility, and this provides valuable data and patient information. Example: if your patient had all of a sudden generalized weakness or onset, become more short of breath, and you could realize that the person was anemic, or they had continued bleeding, or their pH was out of adjustment, it's going to be very valuable data to make clinical decisions on. Must have a basic understanding of common lab tests to do this though. There are 3 types of tests commonly performed: laboratory tests, imaging studies, and then physiological tests. We are actually going to isolate on the lab studies in this section. Some results available immediately, others can take days. Some of these lab results you can send off. There will be specialized labs that are located in other states. You may not have all of your laboratory data in one location, or the ability to run all of your lab tests. Studies are assays performed on the body tissue, and we can do this via stool, urine, blood, or spinal fluid. Abnormal values fall outside of the general overall reference range. Just because you have an abnormal value though, it's suggestive, but it doesn't exactly mean that the person has a specific disease. Clinical data coupled with laboratory data coupled with patient presentation should be considered. Categories of tests. We are going to talk about these. Hematology, which is essentially blood and the blood components. Chemistries, which are all of the electrolytes or central electrolytes of the body. We'll talk about a Chem 7. Microbiology, we're going to talk about staining in this and various types of bacteria. Serology, this is going to be blood typing and so on, and then general overall pathology tests. Now, a pathologist generally needs to run these variations in cellular chains and tissues will be viewed at under the microscope. If they removed a tumor, the tumor could be sectionally looked at by the pathologist and the histologist to determine if it was malignant or cancerous, or it was a benign tumor. Laboratory values are quantitative or qualitative. The quantitative version gives you a numerical value, and the qualitative version gives you a yes or no. Example: the urinary pregnancy tests. They are qualitative. They will give you a yes or a no. A beta HCG is qualitative. They will give you a numeric value. How pregnant are you? Now, if someone is having a spotting or bleeding or has had a spontaneous abortion, generally they will run a quantitative beta HCG, and this can tell them if the HCG is on the rise or it's on the decline. If it's on the decline, then they have probably lost this child. Normal reference ranges established over years, the Gaussian distribution, percentile ranking system, and the values will vary with both age and sex. We will have a little bit of different variance between male and female. Specificity. Specificity measures how well a test detects a disease. Tests that is 100% specific will detect disease at 100% of the individuals who have it. Tests with a high specificity have few false positives. Few tests are 100% specific. So we have varying here of the actual lab tests that we do. Nearly any of them are 100% specific. That, coupled with the clinical presentation, is how we derive or come up with a clinical answer. Sensitivity. Degree to which a test detects disease without yielding a false negative result. Test with high sensitivity has few false negatives, and again, no test is 100% sensitive. We value the measurements off of the metric system. Small quantities are measured, like a picogram, a nanogram, or a milliequivalent. Pardon. Laboratory value measurements are done in International System Units, or SI units. Concentration reported as an amount per unit volume. An example of this is moles, millimoles per liter, or moles or millimoles per liter. Here is how it would be written. Pardon. In another example, blood glucose is done in milligrams per deciliter. Again, off of the metric system and done per a unit of volume. Blood specimen collection. Blood collection in different vacuum tubes. Different tubes contain different substances. Preservatives or anticoagulants or things that will prep the specimen for what needs to be done with it. Different preparations identified by color. Tubes filled in specific order to ensure accuracy. Specific tests require blood collection in specific tubes. Blood cultures are going to be yellow tops, and this is Vacutainer brand. No additive to the tube would be a red top. Coagulation tubes are going to be light blue, and they're going to house sodium heparin in them, and that keeps the blood from coagulating. Serum separator tubes are tiger tops, and these tubes will have a goo down on the bottom of them, and the goo is heavier than the red blood cells but lighter. It's heavier than the plasma but lighter than the red blood cells. So whenever the tube quits spinning in the centrifuge, all the red blood cells will be down here, the serum separator will be in this section here, and then your plasma, where we're going to get all of our electrolytes from, will be nice and free and clear up here. Tiger tops. Heparin tubes are green tops. EDTA tubes are lavender tops. CBCs are mostly run off of these right here. And oxalate fluoride are gray tops. Ammonia levels are generally run off of a gray top. This concludes the part 1 section of introduction. If you have any questions, feel free to contact me. We covered specificity and sensitivity in this section. Roy.Smith@redlandscc.edu or smith@imsa.net. Thank you.